Welcome to Smith Medical Coding Academy, where we discuss everything medical coding. In this video, we're just going to try to take the opportunity to dispel some of the myths versus facts surrounding medical coding. And I just compiled this list based on questions that I received over the years from students who may not understand, what they're getting into, or for someone who just had general questions about the industry. So just try to clarify some of those things. And as we go through some of these myths, just think about some of the questions that you may have surrounding medical coding, and it may help you to make a decision on whether or not you want to take up the education of medical coding, to further your career. The number one question that I always get is it medical billing and medical coding the same thing? Well, they're not. Medical billing is the act of actually setting up the claim to be sent out the door to the insurance company. And medical coding is the act of translating documentation into a standardized code set that can then be put on a claim form for someone to bill. And medical billing and coding together is called the revenue cycle. Revenue cycle, like I said, is medical billing and coding together, and it is all the steps involved from the time a patient or client picks the phone up to make an appointment until the last account is zeroed out or collected. It is a whole complete cycle starting from patient access until the patient is seen by the physician, the account is coded, and it's sent into the insurance company. It is all those administrative functions in between. And since we are putting out video series surrounding medical coding, one of the video series that we will get to is a complete review of revenue cycle, what it is, how it works, and where medical coding fits in revenue cycle. The next myth is that medical coding can be learned in 6 weeks to 4 months. I don't understand this one. There is schooling involved in medical coding. For example, you should have a course in medical terminology, anatomy and physiology, pathophysiology, which is the disease process, pharmacology, and then you should start getting into medical coding, beginning, intermediate, and advanced. So in the span of 4 months, it's almost an impossibility to do that. And get yourself ready for a nationally recognized certification. So in my opinion, this is a major myth. This is not a get quick rich career, and not something that you can take lightly. So this myth has been dispelled. Just so you know that this is real, these are some advertisements that I saw in a few publications that tell you that it is possible for you to get your medical coding certification in a matter of months. And I would never say that anything is impossible. However, it's unlikely that you will effectively learn everything that you need to learn to be successful in getting yourself to be prepared for a nationally recognized medical coding exam. And just to reiterate, nothing is impossible. As a matter of fact, it is possible that you can, but will you be ready for an exam that's 100 questions long and possibly 4 hours? So, although anything is possible, the fact is that it's unlikely that you can get yourself there in a matter of months. In my opinion, it's 8 months at minimum, 8 months to a year. And then after that, you still need time to prepare yourself for a certification, a rigorous certification exam, mind you. And I have had students say, well, isn't medical coding easy? Well, if it were that easy, everybody would be doing it. And like I tell my students, my classroom should be full. And I'll get into medical coding, the best kept secret. I have a video that I'm going to put out surrounding medical coding being the best kept secret, because it's one of those sleeper careers that not a lot of people know a lot about. So again, medical coding is not easy. It's not one of those careers that you should choose because you believe it to be easy. Again, you should be learning medical terminology, anatomy and physiology, pathophysiology, pharmacology, and then, of course, getting yourself prepared to sit for a nationally recognized medical coding exam. And then, like my grandmother always said, nothing worth having is ever going to be easy. So, in fact, medical coding is considered a career now. You have to have knowledge, you have to have skills, practice, and then you have to have the opportunity to apply what you have learned. So, it's considered a career. It's not anything, again, that should be taken lightly. And you do want to take the opportunity to do your research if this is an endeavor that you want to embark upon. This is one that kind of confuses students sometimes. Once they complete their course in medical coding, they think that they have a medical coding certification and are then able to present that to a possible employer and say, see, I'm certified. Well, once you finish your schooling and you obtain your certification of completion, that is totally separate from actually sitting down for a nationally recognized medical coding certification. So, finishing your schooling is really just the beginning. And just to reiterate, we congratulate you on completing your course, but this is just the first step in a line of a few more steps that you have to take before you can get yourself comfortable enough to sit for a nationally recognized medical coding exam. And you'll see why I keep saying nationally recognized medical coding exam in the next few slides. So there are two major organizations in the United States that provide access to certifications for medical coding, and those two organizations are AHIMA, AHIMA, and AAPC. There are a few others that are up and coming, but when you start doing your job research and looking for positions that you may want to apply for, you'll start seeing the certifications that they are asking for. The majority of them are the CPC, CCS, CPB is becoming more requested now that AAPC kind of combined two certifications. So CPB is in that mix. And then also CCA, also, although to a lesser degree. So again, once you graduate or get your diploma or degree in whatever course you're taking that's preparing you, you still have a few more steps that you have to go through. One of those steps is to take a boot camp or some type of certification review in order to prepare yourself and then to actually sit and pass a nationally recognized medical coding exam. So to answer that, once you complete your education, that does not mean that you are now a certified medical coder. That means you have obtained a certificate of completion. I hope that's clear. And myth number 5, once I receive my official certification, if I happen to move, I'll have to recertify with new rules of a new state. Okay, that is not accurate. Once you obtain your nationally recognized medical coding certification, it is yours for life. Now, there are certain stipulations and requirements that you have to meet in order to keep it, but you no longer have to sit for a whole nother exam just because you move to another region of this country. And not only are AHIMA and AAPC recognized all over the United States, they're also recognized worldwide. More than 100 companies accept these coding certifications for employment applications. So, in a sense, they are global. As a matter of fact, the World Health Organization is the organization who came up with the ICD-10-CM. And those are diagnosis codes. So these are recognized nationally and also internationally. I'm not sure if I want to give this the title of a myth because this is not really a myth. This is something that will deter an up and coming medical coder or someone who's interested in medical coding from shying away because they think that opportunities are not readily available for new coders. They are, and if we get the opportunity, we'll walk through some of the job searches and we'll search for new medical coders or entry level medical coding positions so you can see for yourself. So again, this is a myth, and I think it's something that is misunderstood. And sometimes people will shy away from the industry because they believe this to be true, and it is not. You can get a medical coding job with little or no experience. You just have to market yourself a little bit different. And as you think about this myth, you also have to think about your current job or your current career. How long did it take you to get to a place where you had the experience that you needed to move on? So the fact is that highly skilled coders and credential coders are in demand, and a new coder or entry level medical coder may have challenges, but that is you just have to know how to market yourself differently. And one of the things that you should learn or that I'm going to tell you is what not to put on your resume. It is a clear sign that you really have no idea what you want to do specifically. So just keep watching and we'll explain what that is towards the end. As I indicated earlier, we will have a whole series on revenue cycle and each one of the jobs or positions that are considered under revenue cycle. But if you're a medical coder just starting out, consider starting your career in revenue cycle somewhere. And that means somewhere in patient access, health information management, which doesn't necessarily mean being a coder, and then patient financial services. There are so many opportunities involved in revenue cycle. You just have to know what they are specifically. Myth number 7, the only jobs available are those in a doctor's office or in a hospital. Well, in the first few slides, we looked at the Bureau of Labor and Statistics and showed you that there are some jobs in with insurance carriers. Also, if everybody's applying for the same jobs, of course they would look to be scarce. Everybody's applying for the same things. What we want you to know is that there are other positions available in other types of healthcare settings. For example, again, you can work with an insurance carrier. You can work with durable medical equipment or orthotics and supplies. You can work in a law firm, although it may take you a few years to get the experience that you need to work for. An example would be someone who is law firm that specializes in malpractice. They want someone who can review medical records. We have cancer centers all over the country. We have call centers. There are patients that do, or not patients, but employees that do healthcare statistics by way of registries, for example, a tumor registry or cancer registry. There's research facilities. Of course, there's hospitals, there's consulting firms. So there's more than one area for you to find a job as a medical coder. And again, once you pass a nationally recognized medical coding exam, it is understood that you can review a medical record and apply codes. I'm not real sure where myth number 8 comes from, but I do get it sometimes. Medical billing and coding is a data entry only job. And when you say that, it has leaves you with the impression that they think that it is just mindless data entry where you're just copying data onto a spreadsheet or into a computer and there's no thought behind it. But again, you still have to have a skill set. You still have to have the knowledge. You have to have practice, and then you have to have application. This is not a mindless data entry only job. I'm not real sure where that comes from, but I do get that a lot. Again, the facts are that this is an acquired skill set. You have to have the knowledge to do it. You have to have the schooling. You have to have the practice. You have to have the practical application. And then you have to pass a nationally recognized medical coding exam. not just to sit and enter data all day long. It is up to the medical coder to be analytic, detailed, and be thorough in the information that they're reviewing. Medical coders have a high earning potential. This is true with a caveat. It's true that you can earn a pretty decent salary that can, help take care of you and your family well, but you have to crawl before you walk. This is a resume building career. Just like any other industry or any other job that you're in, you still have to learn on the job, use your resume to advance yourself and get yourself to the positions that do pay more. So, medical coding, you can earn a higher salary than average, I believe, but you have to get yourself there. And again, this is resume building. You have to get the experience that you need, choose the type of coding that you want to do, and advance from there. I've heard this one 1,000 times. I have small kids and I want to work from home. Um, it doesn't really work that way. Don't let the reason that you want to be a medical coder be because you want to work from home, because now there are so many other opportunities out there for work from home. You can't have small kids in your home unless they're being supervised by someone else while you're working. You have to set this up like any other office and be free of distraction. Not only are you going to be expected to produce, you're going to be expected to be accurate. And so that's going to be hard to do if you have a baby on your hip. The best thing to do would be to set up your work from home as if your kids were going off to daycare or to a babysitter, and not have the distractions of believing that you can be productive at home and also do childcare. Does not work that way. Thanks for watching. I hope that this has cleared up some of the confusion or questions that you may have had surrounding medical coding. Just remember, our next video series is coming up soon. If you like the content, please remember to like, comment, share, subscribe. Stay motivated. Thanks.